ALS, or amyotrophic lateral sclerosis, is a progressive neurodegenerative disease that affects nerve cells in the brain and spinal cord. Also called Lou Gehrig's disease, over 30,000 people in the U.S. are affected with this right now, with more diagnosed every day. We have Dr. Brandon Bentley joining us again with the Department of Family and Community Medicine with Wellstar MCG Health. Today, we're discussing what's known about ALS and research for treatments as well. Dr. Bentley, good to see you. Thanks for joining us.
Good morning. Glad to be here.
Let's talk about what is ALS?
Yeah, so as you mentioned, ALS, amyotrophic lateral sclerosis, is a neurodegenerative disorder. This is progressive, typically over the course of 2 to 5-ish years. Can vary, though, and this is something being diagnosed every 90 minutes. There's a new person being diagnosed with this. So this is rare, but it is not something that is impossible to find. You'll certainly be able to find someone within your social circles who either knows someone, or you might know someone themselves who has been diagnosed with ALS, and this has been commonly known as Lou Gehrig's disease, who is well known for hopefully a lot of viewers as a very famous baseball player who was diagnosed with this, and his name is now associated with the diagnosis.
Well, so let's talk about this. You're talking about it within your framework of friends and family too. Who gets it?
Yeah, so most frequently diagnosis happens between 40 and 70, with the most common age there at age 55. This is predominantly in men by about 20%. However, as the age increases, this evens out between men and women. And for reasons that are currently unknown, we see there's actually an increase in diagnosis in those who have military service backgrounds.
Really?
So that has been a known correlation. They don't have a direct reason as to why that increased prevalence is occurring.
Okay. Let's talk symptoms now of ALS and how people can get diagnosed.
Yeah, so most commonly, this presents with dysarthria, or difficulty talking, or difficulty swallowing. You can have some weakness in the hands and feet, so something called foot drop, or dropping things like a mug, for instance. And that is frequently some of the first symptoms that will bring these patients to the doctor. Unfortunately, these symptoms are also associated with many other diagnoses, so they're not always identified on that first visit. And then as it progresses, you'll end up having additional symptoms like progressive weakness of extremities, arms and legs, and thus leading to the eventual diagnosis for ALS.
And as of right now, there is no known cure.
Unfortunately, there is not a known cure yet. However, this is why it's so important to have ALS Awareness Month, which is May, so that we can continue to bring awareness of this fatal disease and hopefully continue funding and provide breakthrough research so that we can develop more treatments and hopefully eventually a cure for this neurological disorder.
Okay, let's actually talk about treatments now here to at least manage the condition. What kind of treatments are out there?
So there's currently one treatment that's out there. It looks at improving life by about 2 to 3 months. So while it is not necessarily a very long period of time, when we think about 2 to 3 months, for those with this disease, 2 to 3 months can be everything. It could be, making it to their child's graduation or making it to that wedding so that, they can be there for life moments for the rest of their family. Right. And there's currently the only FDA-approved treatment for ALS. There's a couple adjunct treatments. However, the current research is variable at best to show exactly how much improvement those are providing.
Dr. Bentley, if someone has been diagnosed or maybe as a caregiver, where can people go to get more information on this?
ALS.org has excellent resources both to learn more about the disease and to also get involved in your local community. So that way you can learn more about the disease, how you can help, where you can donate to provide additional research. And if you are suffering from ALS, it can also link you in with support groups for others to help manage and cope with this diagnosis.
And there are a number of support groups out there as well, too. Again, May being ALS Awareness Month, always good to have the facts here, and it's always good to have you giving us the facts here. Dr. Brandon Bentley,
Great to be here. Thanks.